Kia ora. Welcome to the Salmonella webinar, proudly brought to you by MSD Animal Health. I'm Pauline Calvert, a Livestock Business Unit Lead here in New Zealand. And over the next sort of hour or so, we're going to give you some information around Salmonella and what we're seeing occurring in New Zealand. First and foremost, a big thank you to MPI, because some of the data we're sharing with you today is coming directly from the surveillance team, and they do a fantastic job in getting this information together, putting it together in a manner that not only we can understand, make sense, but also communicating with us the importance of getting this information out. So on that note, I'd like to actually introduce our speakers today, and I'll start over to my far right. Will, do you want to introduce yourself?
Yeah, hi there everybody. My name's Will Halliday. I'm a veterinarian. I work for Beef and Lamb New Zealand, and my job title is Senior Advisor for Biosecurity and Animal Welfare.
Thanks, Will. Lisa?
Hi, I'm Lisa Hugh-Moyer. I work for Gribbles Veterinary Laboratories, and I've got a particular interest in Salmonella, so it's really great to be here today, sharing some of my information and joining in the discussion.
Amanda?
Hi, I'm Amanda. I'm a technical veterinarian for MSD Animal Health, and my region is the Lower North Island, which has been a bit of a hot spot for Salmonella. So I spend a lot of time talking to vets and farmers about the disease in outbreaks, and also trying to prevent outbreaks from happening.
So I think probably a good place to start, Amanda. Do you want to give us a bit of a rundown on Salmonella as a disease in itself and kick us off?
Yeah, sure. So just making sure everybody's on the same page with their understanding of the basics of the disease, the different serotypes that we see in New Zealand livestock, and how the changing prevalences over the last few years are being tracked. So firstly, what is Salmonella? Most of you watching this webinar probably know it's a bacterial disease. Lots of species can be affected. It's what's classified as a gram-negative bacteria, and that means that it has a toxin in its cell wall that can make animals and people really sick. In the picture on the bottom right of the slide, you can see like a rod-shaped bacteria with lots of little tails called flagella that help it move. And there are some proteins on the body of the bacteria itself, and then also on the flagella, that determine which serotype the bacteria fits into. And different serotypes require their own special immune response for the animal to fight the disease. So far, about 3,000 serotypes of Salmonella have been identified, but the ones that we care about in New Zealand livestock can fit into sort of 4 main serotypes. And they're all serotypes of the same species and subspecies. So that's Salmonella enterica, subspecies enterica. Typhimurium is, for a long time, was the most common serotype in livestock. It's still one of the most common serotypes in humans. And it tends to cause enteritis, which means gut inflammation and scouring, primarily. It can also cause blood poisoning or septicemia and death, but it's most commonly associated with scouring. Bovis morbificans is a serotype that we're going to talk a lot about tonight or during this webinar. It can cause enteritis as well and septicemia, and it's of particular importance because it's emerging. So we've seen a big increase in case reports of Bovis morbificans, particularly in dairy cattle in the last several years. Brandenburg, a lot of you may have heard of Brandenburg or have dealt with it directly. It tends to cause abortions in late pregnancy in cattle and sheep, and that, as of the recording of this webinar, serotype is just confined to the South Island. At this point, basically the entire South Island does have case reports of Brandenburg. And Hindmarsh, which is predominantly a sheep serotype and tends to cause enteritis in sheep, and a big hotspot for Hindmarsh, at least historically, was the Hawke's Bay type region of the North Island. A new serotype that we're just starting to see, it's brand new since 2019, is Salmonella Give. We don't really know anything about it, so we're MPI is monitoring it pretty closely, and if you do have outbreaks or cases of Give, it would be great to get more information about that. So talking to your local pathologist at your diagnostic laboratory, or talking with the MPI surveillance team, or letting MSD know so we can try and get some more information about Give would be great. All of these serotypes of Salmonella can be transferred to people, so people can become sick with these diseases, and they're all notifiable to milk processors or meat processors. So it's important if you're having cases on a client farm or on your own farm that you let your customer, your milk company or your meat company know that that's happening. Usually that'll mean that they'll put you last on pickup for milk just to try and minimize risk to their own staff. And it would mean that they can help you try and put some mitigation strategies in place. So how does the disease actually work? We can kind of break Salmonella in livestock down into enteric disease and Brandenburg abortions in terms of how they present clinically, how the animals look. Some rough guides to how many animals get sick and die we'll just go through now. So enteric Salmonella in cattle tends to spread by cattle accidentally eating feces from other cattle that have been shedding the bacteria into the environment. So that'll be on the paddock. It can survive for months on the paddock, although it has also been shown to pass from the cow to her fetus. Occasionally vertical transmission that way has been shown, and you can actually give a cow or sheep Salmonella if you put some into their eye or if they inhale it. So if you give them a high enough dose in any way, they can get sick. And if the animal's healthy, it takes a lot of Salmonella to make them sick, millions and millions. But if they are off feed, if they're stressed, if there's been a recent diet change, then many, many fewer Salmonella bacteria are required to make the animal sick. So it might just be hundreds or thousands of bacteria rather than millions and millions. As I mentioned a moment ago, the Salmonella can survive for months in the right type of environment. So in dry dust of sheep yards, it's been known to survive for months. In very wet weather, in kind of the perfect environmental conditions, it can survive for months. And those case peaks tend to happen, and bad years for calf scours caused by Salmonella tend to happen in wetter seasons. For an enteric outbreak, the average that's been reported in the New Zealand literature is about 10% of a dairy herd, becoming sick, and mortality rates can vary. Probably around 2% would be a reasonable average in a dairy herd. But that can depend quite a bit on what other factors are going on. So what's actually caused the outbreak, which we'll talk more about later, and what sort of condition are those animals in. So that's all enteric Salmonella, so the kind that affects the gut. Brandenburg causes quite a different syndrome, and it causes late-term abortions primarily, but it also kills animals, and it can cause scouring. It's also spread by animals accidentally eating the bacteria, either if there have been aborted materials left in the paddock or if it's being shed in feces or reproductive secretions. The infective dose hasn't really been very well described in the literature, and sometimes what's been demonstrated to cause disease in some situations isn't enough to cause disease in other situations, so it's not really clear how much an animal needs to eat to get sick. Similar to the enteric serotypes, it can survive for months in the environment. And in a herd that has never had Brandenburg before, or a flock that's never had Brandenburg before, it can be quite spectacular. So you get a lot of sick animals, particularly first calving heifers or two-tooth ewes tend to be quite significantly affected, with lots of them getting sick. So the average in a survey that we did a couple of years ago for MSD showed about 13% of first calf heifers would become sick on average, and 2% of mixed age cows if the herd had mixed age cows affected. Most of those Brandenburg outbreaks go on in late gestation, so right in the early spring period or late winter period, and they last about a month, quite explosive. And mortality can vary quite a bit again, depending on what else is going on the farm, what's precipitated the outbreak. Heifers have been shown to have mortality rates up to 9%, so it can be very significant impact on that farm. But again, it depends on sort of what the herd history is and how the outbreak's managed and contained. Okay, so this is what's been going on in New Zealand, and this is really what's behind the whole series of roadshows that we've been doing and the webinar in and of itself. This is why we're bringing all of this to you. Before 2013, almost all cases of Salmonella in cattle were caused by typhimurium, and that's a serotype that's been around for a really long time. It used to cause sometimes outbreaks, but often it would kind of cause a case here or there and nothing super worrying. But over the last since 2010-11, the epidemiology of Salmonella has kind of been changing. So there have been a lot more explosive outbreaks occurring at odd times of year, not necessarily the traditional calving time when cattle are really stressed. They've been occurring throughout the year. And then since 2014-15, we've also been seeing an emergence of bovis morbificans spreading throughout the country. So we're kind of thinking of Salmonella in general, the trend is going up, and then the serotype distribution is also changing. It's acting like an emerging disease, which is a bit of a worry because there's so many unknowns about Salmonella in New Zealand. We don't have a lot of research to go by, so we need to be looking at it, keeping an eye on it, particularly the newer serotypes, bovis morbificans and GIV.
Amanda, on that slide you've just showed us, you're talking about 600 cases. What does that mean? Is that an individual animal or is that a...
Yeah, great point. So these are MPI confirmed Salmonella cases in cattle. For every farm that has a case or an outbreak, they can submit one sample or one isolate from that case to ESR for serotyping. So that case could represent a single case on a farm, or it could represent an outbreak where half the herd's affected. So we don't actually know by looking at this data set how many sick animals are behind that, but we can say there are 600 different cases or outbreaks that have been reported to MPI. And you can see that that's a significant increase over the 100 or 120 that we were seeing per year pretty steadily prior to 2014.
So if we put that in context, Amanda, over 600 cases, if we make that assumption that that's one farm, in terms of prevalence on New Zealand farms, how many cases are we actually really seeing on dairy farms?
Yeah, so if you assume that those are all coming off of farms that have milking dairy cows, which they won't be, but it's an assumption for numbers' sake, we have about 11,000 dairy farms in New Zealand. So if 600 dairy farms are affected, that's about 5%. So just putting it in an order of magnitude that's easy to understand, about 5% of dairy farms are being affected a year. But don't get too attached to that number because probably a lot of those cases might be coming from calf rearing operations that don't have milking herds. So the denominator, if you like, is probably a bit bigger than that. But it puts it in context a bit to think about 5%.
Yeah. So I've got a question as well. I just wonder, for those farmers who perhaps haven't seen it before, what sort of symptoms are they looking at?
Yeah.
What's going to sort of flip that switch that, this could be Salmonella?
Yeah. Often, so it depends on which serotype you're seeing and what the background immunity of the herd is and what stress event has started the outbreak. You might see dead animals as your first sign. You might see abortions as your first sign, or most commonly you'll see scouring with some blood and very off-color cows as your first sign. So it does, and Lisa, you might weigh in on this as well, what you see from the lab perspective, but it kind of does depend a bit. Is there anything you'd like to add on that?
Yeah, no, I think, the large majority of our cases are scouring cases, or if you're talking about calves, sudden death. But with Brandenburg, obviously, we're also seeing abortion. But yeah.
Hey, Will, we've heard a lot about Salmonella in dairy cows. Perhaps it's a good opportunity to talk to our listeners around what's it like in sheep?
Sure. Okay. So it's important to remember there are two different types, really, or two different disease syndromes that we see in sheep. So one of them being the enteric type that is normally associated with hindmarsh, and that's up and down the country. And really, it's pretty simple. You're going to find multiple dead sheep. They will generally have a really nasty green scour, very smelly green scour. It's important, don't touch them. Or if you do, wash your hands afterwards. The other type that we see is the Brandenburg type, which is, it really manifests as an abortion storm. So you'll see a lot of ewes aborting all at the same time. Once again, don't touch it, go and call your vet.
So I guess if you're a farmer watching and you notice particularly at high risk times of year when the animals are quite stressed, so around calving or late gestation, or even between calving and mating, anytime there's a big diet change, if you're seeing scouring, deaths, it is worth getting on top of and probably getting your vet involved sooner rather than later, and not saying, oh, livestock, dead stock, let's wait and see what happens. Get onto it, because once that outbreak starts to snowball, it's harder to stop. So the longer you wait, the harder it is to get ahead of.
Probably worth reiterating as well, you mentioned that it can be passed into humans.
Yes.
So, yeah, good hygiene,
Yes.
washing your hands, etc. after handling those animals.
Yeah. Absolutely. So if you're calving cows, trying to wear shoulder-length gloves, making sure you're washing your hands, trying not to let your kids get in with sick calves. That's, if you have sick animals, trying to isolate them and put some biosecurity around them, so foot baths, things like that. Assume you can get sick. If an animal's sick, assume it could make you sick, and that's probably the safest assumption. Yeah. Cool. Okay. So the next slide is just looking at the regional prevalence of each of these 4 serotypes that are the most common in cattle. For Brandenburg, Bovis morbificans, and Typhimurium, the heat maps on this slide are from 2019 data. For Salmonella Give, it was just appearing in 2019. So this is 2020 data in the map for Salmonella Give. So we'll start on the left. As I mentioned, Brandenburg at this point is still confined to the South Island. 2019 was actually a relatively light year for Brandenburg, so it sort of peaked. The brightest red year for Salmonella Brandenburg was, I think, 2017. And it's backed off a little bit, probably as the South Island cows have gotten a little bit of immunity and or been vaccinated on the herds that are affected. Bovis morbificans is still rip-roaring around the place. So it started on the North Island and is now represented basically everywhere. Typhimurium's everywhere, and it's been everywhere forever, basically. So there are surveys from the 60s in which Typhimurium was around and pretty common in dairy cattle. Give is, at this point, focused in the Waikato, and Lisa, you were saying the South Waikato.
In particular, yeah.
Yeah. So the odd case from the Bay of Plenty, but pretty much the Waikato, as of 2020, is sort of ground zero for Give.
So I think we've heard a lot about what is Salmonella. We've talked about some of the severity of this disease, I guess, in terms of mortality and morbidity. But I think now there's probably a lot of people on this call today that really want to understand what are the real risk factors on farm and what can they actually be doing either in an outbreak and perhaps more importantly think about prevention.
Yeah, thanks, Pauline. So we will talk about risk factors and mitigation strategies for Salmonella, but because MSD Animal Health, the company that Pauline and I work for, are the manufacturers of the Salmonella vaccine available for sheep and cattle in New Zealand, Salvexin Plus B, I will talk through some frequently asked questions that, as a technical team, we get asked regularly to try to preempt those and encourage best practice use of the vaccine so you're getting what you expect out of it when you use it. So firstly, we've talked about the changing trends in Salmonella in cattle, but where are these outbreaks coming from on a farm? And as I was saying, we don't really know. There hasn't been that much research into it, but looking at the overseas literature and some old Salmonella surveys in dairy cattle from the 60s, it's most likely that most outbreaks are probably moving around with cattle. Once a serotype comes into the national dairy herd and gets set up in cows, it then is probably moving around mostly with cows. Similar for sheep, once disease like hindmarsh is established in a sheep population, it's then probably moving around with animal movements. So just like Will said, animal diseases tend to move with those animals. In Salmonella, the bacteria can establish carrier states. So in healthy-looking animals that aren't clinically sick, they can still be shedding Salmonella in their feces from time to time. And for each different type of Salmonella, that carrier state could be a different amount of time. So Dublin, which we don't have in New Zealand, can establish lifelong carrier states. For Typhimurium and Brandenburg, that carrier state's probably more like about 6 months, but it can really depend on the serotype and the animal. Some surveys in New Zealand have shown from healthy animals anywhere from 0.3% to 15% of cattle could be shedding Salmonella in their feces, and that those surveys were done when Typhimurium was the predominant serotype. So we don't really know for Bovis morbificans and Brandenburg. And that depends a bit on seasonality, so when you look for it, as well as the amount of stress those animals are under when you go looking. Internationally, shedding of Salmonella in the feces of cattle has been reported at varying rates in different countries, and an international systematic review done in 2019 tried to look at all the different papers done throughout the world and average them. And on taking all those papers together, there's a 9% global average for healthy cattle shedding Salmonella in their feces. Birds are often blamed for Salmonella outbreaks, so whether it's ducks or seagulls, farmers and vets will often suspect that that's how it's gotten onto the farm. So there have been a couple of papers that have been able to find Salmonella on the feet or the feces of birds, but it's unlikely that for most outbreaks that's really where it's coming from. Because if you think about the volume of feces that one bird, or the volume of bacteria that one bird can move around, it's a lot less than what a cow or a sheep would move around with them. So although it could happen, it's less likely to be the cause for most outbreaks. And again, feed. So a lot of times an outbreak will be associated with a change in feed quality, and so it makes sense to go looking for the bacteria in the feed and say that it was contaminated feed that brought that bacteria or that particular serotype onto the farm. In the literature, often that's really unrewarding to go sampling feed and culturing it. You usually don't find Salmonella in the feed. If there's a feed change associated with an outbreak, it's usually because it's changed the gut environment for that group of animals and caused some sort of stress or change in pH in the gut environment that then means the Salmonella that's already there circulating around can take off and cause clinical disease. So any diet change or stress basically is the underlying trigger for Salmonella disease. Often it's subclinical. Of course, for these new emerging serotypes, they have to have come from somewhere originally, but it's likely that once they're established in a group of cattle, it's then moving with cattle. As I said at the beginning, in a healthy animal, it takes a lot of Salmonella bacteria to make that animal sick. You have to try really hard. In a stressed or fasted animal with an upset gut, it takes many, many fewer Salmonella bacteria to make that animal sick. To support that, there's one case that I can share with you, which is a field study that we were doing to look at how much the vaccine increases antibodies in calves. If you vaccinate the dams at dry off and then feed that colostrum to the calves, how much antibody gets passed through into those calves. So we were looking at that in 2019 in Canterbury. And to do that study, we wanted to find a herd that had no Salmonella in it, ideally, or no history of salmonellosis, and had never vaccinated. Because we wanted to start with cows that had little or no antibody in their blood, vaccinate them, cause them to have an increase in antibody, and then that antibody from the vaccine to get through the colostrum to the calves. So we picked a herd that had never had any cases of Salmonella diagnosed, they'd never vaccinated. But when we went and actually tested the cows, a lot of them were positive before vaccination for all 3 serotypes that we tested for. And I should say that the test that we used, the ELISA antibody test, was developed for this study. It hasn't been validated. It's not a commercially validated test. So we're not sure how repeatable it would be or how robust the results would be, but it was interesting to see that a lot of the animals before we ever vaccinated them were positive for all 3 serotypes. And for Brandenburg, over the study period, there was an increase in the amount of antibody in the cows that were not vaccinated. So that's that middle graph there. On the left side, the control animals increased significantly. The increase for Bovis morbificans and Typhimurium wasn't statistically significant, but you can see there is a bit of a numerical increase there. So what does this tell us? It tells us that, you know, this is one farm, so it's one story, one anecdote, but it shows that on a farm that we didn't think there was salmonella floating around, there probably was. And it looks like there might have been all 3 serotypes that we went looking for, or at least a history of those serotypes, those animals being exposed to those serotypes. So what are the risk factors that have been identified in the literature for either shedding salmonella or being dairy cattle being sick with salmonella? If the herd obviously has had a recent outbreak or a recent case, then you're more likely to find the bacteria if you go looking for it in healthy cattle in the same herd. That makes sense. And geographic hotspot means if you're in an area like the west coast of the South Island in 2018, where Brandenburg had just come over into that region and was starting to spread through that region, then that's a geographic hotspot. Similarly, Taranaki with Bovis morbificans for several years was a geographic hotspot. So that being in that area would increase your likelihood of having an outbreak. Mixing cattle from different sources or a large herd size. So that's the idea that you would potentially buy in or bring home carrier cattle that have been exposed recently. They may or may not appear sick. Large herd size in the literature in terms of being at increased risk for salmonella is around 500 cows. So by New Zealand standards, not a huge herd, but internationally that's quite a large herd. Stress in animal movements. So that makes sense because we know how the bacteria works and establishes itself. Anything that takes animals off feed, reduces volatile fatty acid production, changes the pH of the gut, is likely to predispose animals to salmonella. And then intensive feeding. This is not been really demonstrated for Brandenburg abortions, but for the enteric forms of the disease, there have been a couple of feeding practices that have really been implicated. So pelletized magnesium oxide supplementation is the main one. Using pelletized magnesium oxide supplementation through in-shed feeding has been shown to be a significant risk factor for salmonella outbreaks. Particularly, that work was done in the Taranaki in 2000 from outbreaks that happened around 2011. And then having a vaccination program in place does reduce the likelihood of shedding. It reduces shedding and it reduces the risk of outbreaks and the severity of outbreaks. Liver fluke is an interesting one, which hasn't been shown to be a risk factor in New Zealand. Nobody's looked at it, as far as I'm aware, in New Zealand. But in sheep and cattle overseas, animals that have liver fluke are more likely to become sick with salmonella. And then just to re-emphasize that for New Zealand, one of the only papers that's been done looking at risk factors for salmonella outbreaks in dairy cattle did implicate pelletized magnesium supplementation as a major risk factor. So you can see in this graph, every year there was a peak of salmonella outbreaks around spring. A pelletized magnesium supplement was taken off the market, and then in the subsequent spring, that peak was much lower. So it's worth checking how you're supplementing magnesium oxide to cows. You need to do it, obviously, to prevent milk fever, but it's important to check how you're doing it, how well that product's being mixed, how well it's being blended, how well it's being fed out, and the rates as well, so how much is going in. And it may be preferable to dust rather than use a pelletized magnesium supplement. The reason that these products are used is because they don't create dust and they're preferred by feed mills for ease of mixing. But the problem is that they can pass through into the intestine without being broken down, or they might not be mixed homogeneously through a batch of feed. So some animals might get a big slug of it and some might not, and on a given day they might get more than on the next day. So the pH fluctuations in the gut are likely what's creating the problem. So a higher pH reduces the amount of bacteria that the animal needs to eat to get sick. So for a typical outbreak on a 400 cow farm, if they have 2% mortality and 10% of animals getting sick or morbidity, an outbreak would be estimated to cost around $34,000 on a 400 cow farm for an enteric outbreak. And then if you think about a farm's risk profile, if they're a really low risk farm because they're low production, low input, nobody in their area has salmonella, you've never seen it there before, they're not changing anything about their management system, maybe they are truly closed herd, maybe they don't graze any animals off, sort of a system 1 or 2. If that's a low risk farm, their annual risk of an outbreak would be very low. Maybe 1 in 50 years they might be at risk of an outbreak. Whereas if they're a high-risk farm that's doing all the opposite things, so lots of animal movements, large herd, pelletized magnesium supplementation, they would be at a much higher risk of an outbreak in any given year. So maybe they would be at risk of an outbreak 1 in 10 years, maybe even more often than that. So I've just annualized the cost of an outbreak by dividing the 34,000 by either 50 or by 10. So for a low-risk herd, the annual cost of disease is somewhere around $600 or $700. For a high-risk herd, it would be $3,000 to $4,000. And the reason that I've done that is just to give you a sense of how much money it's logical to throw at salmonella mitigation. So in a given year, how much does it make sense to spend on trying to prevent or manage salmonella? And it's a relatively conservative estimate because I have not assumed that any of the calves or heifers are clinically affected. I haven't accounted for an inability to supply milk. So if your milk is full of salmonella, you may not be able to supply until the outbreak has quieted down. I haven't accounted for any zoonotic disease risk. So for salmonella, if there are human cases linked to disease in cattle, it's most likely coming from direct contact with those cattle. So it gets pasteurized out of milk, so you don't need to worry about drinking milk from the store. It's not going to be full of salmonella. It shouldn't make you sick. Similarly, eating beef or lamb, there's not a food safety risk. They're monitoring rates of salmonella recovered from carcasses, and that is not on the rise. What we're really talking about here is the risk that working directly with sick cattle could potentially make you sick. This hasn't accounted for the selection of antimicrobial resistance because, as we talked about earlier, a lot of farmers and vets need to use antibiotics to help get an outbreak under control. Back of the envelope calculation, an outbreak of this size would use about 6 liters of oxytetracycline or trimethoprim sulfa to treat that 10% of cows that get sick. And it doesn't account for any impact on the subsequent mating, because a lot of outbreaks happen over calving when the cows are trying to get set up for the next mating. So it doesn't account for any impact on reproduction. And as I said, this is an enteric outbreak. So Brandenburg outbreaks are often much more costly, much more dramatic. So what can you do about salmonella to try and reduce its impact? We've talked about how the disease works. So the most important thing you can do is try to eliminate that trigger. So whatever it is that's set up the outbreak in the first place. So if that's a diet change that hasn't been managed very well, if it's a pelletized magnesium oxide supplement that you can replace with dusting, if there's something you can do to try to minimize stress, if there's something you can do to improve hygiene, so that would be things like if a cow aborts from salmonella, removing that aborted material and burying it, isolating sick animals, making sure you're not feeding milk from scouring cows to your calves because it can pass through the milk, not just through the feces. Avoid grazing your at-risk groups of animals, so that would be your springers, your colostrums, and your young stock on effluent paddocks, if you can avoid that. And then storing and feeding supplements to minimize fecal contamination from other animals. Those are some hygiene mitigation strategies. And then lastly, as I mentioned, we manufacture Salvexin B, which is the salmonella vaccine for sheep and cattle available in New Zealand, and that can be used preventatively or in the face of an outbreak. The whole purpose of this awareness campaign that we're doing is to try and get people thinking preventatively about salmonella. So that's really what we're trying to encourage, preventing those outbreaks as much as you can from happening in the first place. The vaccine reduces shedding significantly, so that will reduce environmental contamination. It reduces the number of animals that get sick from salmonella, and it reduces stock losses, so mortality and then potentially production losses caused by animals getting sick. This graph shows the case trend, which both Lisa and I talked about earlier, showing the increase from between 100 and 200 cases, both sheep and cattle salmonella cases per year reported to MPI in 2013, up to where we're sitting now, which is over 600 cases reported to MPI per year. You can see that we haven't really talked about the sheep cases. And Will, this is probably an area of particular interest for you, being beef and lamb representative, so now might be a good time to mention that. In the reported cases to MPI, the sheep cases tend to sort of go up and down with the season, depending on feed quality, particularly in the autumn period. But Lisa, you might be able to comment on what your feeling is about how accurate the reporting of sheep cases is. What's your thought on that?
Yeah, I think sheep are a little bit more difficult to monitor trends in, because I think probably less cases end up being submitted to the lab. So, we've probably got less going, oversight on the sheep cases. So, yeah, it's kind of difficult to know with sheep. Certainly I can say we have had a very small number of bovis morbificans outbreaks in sheep flocks, and a couple of those have been quite significant mortalities associated with them. But I think because we're not capturing all of the cases that are occurring, that it's kind of very difficult to say, what the sort of trends and whether there are any changes happening within sheep. So,
Okay. Traditionally, Salvexin has been primarily used in sheep, so the majority of the doses of Salvexin plus B, and before the plus B, before Brandenburg was added, just regular Salvexin, the majority of those doses have gone into sheep. You can see the red line in this graph is the vaccination dose sales trend, but there's no scale on the right-hand side for that. Because it's commercially sensitive, but you can see that the trend tracks the case trend. So we think, unfortunately we can't quite pull out which doses are going into cattle and which are going into sheep, but we believe that the increase in our sales since 2016 is primarily going into dairy cattle because of the increasing case trend in dairy cattle. The vaccine itself contains, it's a killed bacterin vaccine, so we take isolates of each of the serotypes of Salmonella, Typhimurium, Hindmarsh, Bovis morbificans, and Brandenburg. They're killed and they're put into the vaccine whole. Traditionally, the vaccine gets prescribed in the face of an outbreak on a farm. So when a farm has an outbreak, they'll get in and vaccinate, and then they usually will keep up that vaccination year on year after that, because they know that Salmonella is in their herd or flock. In a perfect world, we'd like to prevent that from happening in the first place and get more people preventatively vaccinating so that the farm doesn't have to go through that quite traumatic outbreak situation in that first year. Although sales are on the rise for Salvexin, we still have relatively low penetration. So we estimate about 5 to 10% of the national herd/flock is vaccinated. And unfortunately, generally farmers aren't really aware of the vaccine and that it's an option unless they've had an outbreak, which is what we're trying to change, because it's one of the tools for prevention. So it's part of the package, and we're hoping that increasing awareness of the disease, the changing trends in the disease, will help that conversation be had so farmers can make an informed decision about which tools they need to use on their farm. So I'll just, for the next couple slides, I'll go through some frequently asked questions about the use of the vaccine, because it's what, as a technical team, we spend quite a lot of time doing, talking to vets and farmers on the phone about what to expect from the vaccine and how best to use it. So in an outbreak situation, you can expect, if you get in and vaccinate a herd of cows or a flock of sheep for that matter, in the face of an outbreak, you could expect new cases to stop about 2 weeks after the first dose. It's a killed vaccine, so really it needs 2 doses for full efficacy. So we're still recommending boostering that vaccine, even if cases have stopped boostering at 4 weeks after the first dose. Another question we get asked is, if you have a serotype that's not one of the 4 that's in the vaccine, will the vaccine still work? It The answer is we don't know because we haven't tested efficacy against the serotypes that aren't in the vaccine. And it probably depends on how similar the proteins on the body and the flagella of the bacteria are to the ones that are in the vaccine. So it might depend from serotype to serotype how much cross-protection you'll get. If you're using the vaccine preventatively in healthy animals, it's worth bearing in mind that it is a gram-negative vaccine, which means that the toxin that's in the cell wall of the bacteria can make animals feel a bit sick for a day or two. So in healthy animals where there's no outbreak going on, you may see a bit of a fever, a bit of a milk drop for a couple of days. If you're vaccinating preventatively in healthy animals, the efficacy that you'll see will depend on how much challenge and what other triggers and stress factors are going on. So if you have a lot of environmental contamination, the animals are really stressed, you may still see a few cases of Salmonella even in a vaccinated herd or flock. So it's not a standalone silver bullet, it's part of the package of tools for prevention and mitigation. We have demonstrated in quite large field studies that the vaccine reduces mortality by 50% for Brandenburg, and this is primarily in sheep that these field studies were done, and 90 to 100% for enteric, which in the case of the vaccine was predominantly hindmarsh and typhimurium. How old can animals be when you give the vaccine? There's no label minimum age, so it can be given and is given quite often in quite young animals. We would like at least the first dose to be before the animals are at risk. So we know in calves, they are often at risk within the first few weeks of life, so we have lots of people that give the vaccine to quite young calves. But if you're doing that, we sometimes recommend trying to wait a day or two after they come off the truck to separate the stress event from vaccination, because if an animal's really stressed, it might not respond as well to vaccination. As I mentioned, the vaccine's a gram-negative vaccine. It can cause a bit of a milk drop for a few days. So if you're using it preventatively, then the best time to give it is around late lactation or dry off, when that slight drop in milk isn't going to impact the farm. And we'd ideally like you to separate it from other vaccines for that reason. So a couple slides ago, I mentioned that we had a farm that we did a trial on to look at whether vaccine-induced antibody passed through the colostrum into calves. And we went looking on that farm and found that they had Salmonella already, probably. But the result of that study was that yes, basically, by vaccinating the dams at dry off or pre-calving, more antibody got through into the colostrum and then into the calves than if they were born to non-vaccinated dams. So we confirmed that passive transfer of antibodies, and it didn't matter whether the cows were vaccinated at dry off, which was the end of May for an August 10th calving, or whether they were vaccinated in July. So there was no difference between doing them in the middle or towards the end of their dry period versus at dry off. So from a practicalities point of view, for most dairy farms, around dry off would be the best time to preventatively vaccinate. This farm had 30% failure of passive transfer, so 30% of the calves basically didn't receive enough colostrum within the first day of life, and that's average. That's a normal level of passive transfer on a dairy farm. So there weren't any sort of special colostrum management practices in place that are needed to get this effect. So if you're thinking about whether or not the vaccine should be used preventatively, we can come back to our estimated cost of disease per year on a high or low risk dairy farm to try and help make that decision. So if you think about a low risk dairy farm having an annual cost of disease of between $600 and $700, and a high risk dairy farm having an annual cost of disease between $3,000 and $4,000, the cost of vaccinating a 400 cow herd is about $1,200 a year, and that's quite a high-end estimate because only about half of that is the direct cost of vaccination. The vaccine's very economical for a dairy herd. It is a very cost-effective vaccine. What I've also added to the direct cost of vaccination is the cost of doing all the young stock, so setting the calves up with at least with 2 doses and then beginning to booster the heifers and the cows from there. I've also calculated the cost of that milk drop for a couple of days in your milking herd, and I've included the cost of labor to actually do it all. So it depends on whether you want to consider those extra things or whether you just want to talk about the direct cost of vaccine as to where your threshold is for recommending preventative vaccination. The take home from this is that for herds with risk factors and for risk-averse farmers, preventative vaccination probably makes sense. In addition to the financial considerations of preventative vaccination, there's all the other things that we've already talked about, the non-financial considerations. More widespread preventative vaccination, and this is for any disease really, should hopefully reduce antibiotic use, prevent unnecessary animal suffering, provide peace of mind to the farmer, the consumer, and the milk processor. And in that case, the consumer would be consumer of raw milk primarily. So if the farmer drinks raw milk out of the vat, or there's someone drinking raw milk from the public, that would be the primary risk to a consumer. It will save time and stress over calving, because that's when the bulk of outbreaks occur, and reduce zoonotic disease risk, again, from direct occupational exposure or consuming raw milk. And again, as I said, sometimes if the outbreak is putting a lot of Salmonella into the milk, you might not be able to supply until the outbreak's resolved, so it helps safeguard your ability to supply milk. So that's really all from me. I guess the take-home points from this are Salmonella is everywhere, and it is endemic in dairy cattle. Although the serotypes are changing, cattle are a reservoir for the disease. We need to be keeping an eye on emerging serotypes and how they're trending, and be mindful of the risk to farm workers, the family of the farmer, people in direct contact with sick animals, or those consuming raw milk. There are a lot of things you can do to try and reduce your risk. The most important thing is managing stressed animals, managing cows over the calving period to try to reduce changes to their gut, essentially, and manage dietary transitions really well, paying particular attention to pelletized magnesium supplementation, and improving hygiene. Preventative vaccination would be warranted if the herd is high risk. It's not going to eliminate disease, but it will reduce morbidity and mortality significantly, reduce shedding, and provide some passive immunity to calves. There's still a lot we don't know, so a lot of this is speculative in terms of New Zealand's specific situation, so we've had to take information from the international literature and kind of bring it across and assume that those things apply, so there's a lot of research still to be done. And the last thing that I'll mention is that we have a couple of podcasts available on topfarmers.co.nz, which talk about Salmonella in more of a conversational tone with some stories, some case examples, and interviews with affected people. And that's all from me.
Thank you. Thank you, Amanda. That was really interesting, and thanks for giving us such a good overview of all of the risks that farmers and veterinarians need to consider. I guess to wrap it up, I might just start off with just throwing it over to you, Will. I know you're here, you're a veterinarian, you have been a farmer, and obviously you're here advocating for farmers. What's the take-home message that you'd like your members to know about?
Yeah, I guess thanks very much for all the input we've had from you guys today. It's been fantastic. Yeah, take-home messages. It's not just cattle, obviously, that are affected. Sheep get it. It can have devastating consequences in a sheep flock. So the hindmarsh, for example, nationwide, can cause significant mortality and morbidity. So that's deaths and infections in your flock. Around those crunch times, and it's when they're under stress, and usually around some sort of nutritional stress, as we're being told. So it's those sudden changes in diet, or even where maybe the feed isn't up to the quality or the quantity that you'd like for that time of year. So one of those mitigating strategies, as we've talked about it, one of those big tools in the toolbox is to make sure that those animals they're having their feed managed correctly, no sudden changes, and that they're well fed and otherwise healthy.
So Will, obviously the conversation today is mostly focused on dairy cows because that's where we've seen a really obvious increase in cases. But for you, coming from the beef and lamb perspective, how do you think about those industries crossing over, and what's the relevance or the crossover messaging?
Sure. So there really is no siloing of those two industries nowadays. We've got dairy cattle grazing on sheep and beef blocks over winter or other times of the year, calves being raised on different properties, etc. So there's an awful lot of crossover there. So really, I guess if there's the opportunity to keep those animals separate, then you can mitigate the spread of not just Salmonella, but many other diseases that occur in these livestock. So yeah, that would be a good one. Probably also worth mentioning, we've heard it before, the fact that Salmonella does affect people. Okay, so people are the most valuable animal on the farm, aren't they? And can you really say that you can afford to spend 2 weeks in hospital if the worst comes to the worst? So keep those people who would be most at risk, anyone who might be immunocompromised, for example, or children or old people. Try and keep them away from any sick animals, and just make sure you wash your hands and keep safe.
Thank you, Will, and thank you for contributing today. It's been fantastic.
My pleasure.
Amanda, I'm going to throw it over to you. Just what's the take-home message, really? There's a number of veterinarians on the call today listening in. What's your take-home message to veterinarians?
So our take-home, the whole reason that we've tried to bring this awareness campaign to vets and farmers is to try to get those prevention conversations happening. So that risk factors are floating around in your mind. You're constantly thinking about, okay, what is my risk profile? Is it worth me proactively doing something to try to prevent or manage salmonellosis? And just as Will mentioned, a lot of the things that you would do will also help with other infectious diseases. So it's never a bad idea to have good hygiene. It's never a bad idea to think about asking some questions about herd history, or maybe checking in with your neighbors about what's been going on in their place. One thing we haven't mentioned is if you do have an outbreak, it is a good idea to tell your neighbors. I know it can be a little bit embarrassing if there's an animal health problem on your farm, but you're potentially, you could be saving them a big headache if they can get in and maybe preventatively vaccinate their stock, or try and put up some more boundary measures. Maybe if they need to walk stock down the road, they might take them a different route or something like that. So it's quite a considerate thing to let your close contacts or neighbors know if you're having a problem. Let your milk processor know. And proactively having those veterinarian farmer conversations around what's your strategy if you start to see cases, or what do we need to do to try and prevent cases in the first place? Are there some things we can put in place? Maybe preventative vaccination if it's warranted, maybe some improved biosecurity measures, maybe some improved hygiene measures.
Thank you. Thank you, Amanda.
Yeah, thank you, Pauline.
That's great. So thank you everyone for joining with us today, and I hope you found this format informative. I've certainly learnt quite a lot today, and I really want to thank both Will, Lisa and Amanda for their input today. I think in summary, we're talking about animal welfare, we're talking about significant risk to farmers' income, to their production, probably their mental well-being, considering how severe some of these outbreaks can be. And I think also the public health risk here is significant. So I hope what we've shared with you today can help form some great discussions with both veterinarians to farmers and farmers about this disease. Thank you.